Okay, we'll get started. Good morning, everyone, and welcome. I'm Christine Robertson, Executive Vice President, Chief of Staff for Eastern Minority Supplier Development Council. I thank you for joining us today for this very important topic on vaccines in the workplace. We are always looking to bring opportunities to you, whether it's in business development, sourcing connections, or webinars like this to help keep you up to date on topics relevant for you and your business. I'm sure you'll all have a lot of questions. Please put them in the chat. Please put them in the Q&A and put your comments in the chat. Someone will be monitoring that for you, and then we'll have a Q&A at the end of the presentation. Also, you'll receive the recording after the session and a brief survey. Please complete the survey for us. It'll help us in planning future HR workshops and seminars for you. With that, I'd like to introduce Manuel Torres, Business Performance Advisor for Insperity, to share a little about Insperity and introduce today's speakers.
Thanks, Christine. Good morning, everyone. And thanks for taking time from your busy schedules today to join us for this session. As Christine mentioned, I'm Manuel Torres from Insperity. My job is to work in the community and help business leaders find answers to the HR and related concerns that they have as they look to grow their organizations. Insperity is a premier human resource services company that focuses on helping small and medium-sized businesses run better, grow faster, and make more money. And who doesn't want to do all that? We do that by helping them improve their human capital management efforts with similar tools and resources to which you would find at a Fortune 500 company to make them an employer of choice. Insperity is proud to not only be the subject matter experts presenting today, but to also serve EMSDC as one of our clients. Val and Christine have valued that relationship and invited us to do an HR series to share some of our expertise as a value add for the members and clients of EMSDC. So today we're going to be presenting on a very timely subject, vaccinations in the workplace. This topic is top of mind for many business leaders, as you see it almost every day as a headline in almost every business publication. Presenting today are Sharice Sargent and Peter Zaretsky. Sharice is a human resource specialist within client services at Insperity. She began her career in IT system development prior to transitioning into recruiting and later employee relations. After several roles within healthcare, IT, and human services industries, she became a consultant specializing in full HR services for multiple industries. Originally from Philadelphia, Sharice grew up in a large family who traveled often. She enjoys spending time with extended family and friends over dinner and games. She's very active, however. There are times she enjoys her favorite chair reading a memoir or fact-finding on various topics. She enjoys renewing and or repurposing items such as furniture and clothing. It provides a perfect balance as a therapeutic challenge. Also, she likes to go to artistic events, frequenting concert halls, theaters, and art exhibits. Sharice is a retired U.S. Air Force veteran who continues to support organizations who promote the inclusivity of military members and their families. And Peter is a safety service manager working with clients across many industries and consults on issues related to workplace safety, loss control, and injury prevention. Peter is a board certified safety professional and has been with Insperity since 2015. He previously worked in manufacturing and healthcare industries, as well as in higher education and in the public sector for the last 14 years. As Christine mentioned, as we go through the presentation, you will have questions. Please put them in the Q&A section at the bottom of the presentation, and we'll direct them. We will address them directly at the end of the presentation. And with that, I want to thank you all and turn it over to Sharice and Peter.
Thank you very much, Manuel, and good morning, everyone. We are very happy to be joining you today. And as it was already mentioned, vaccination is a hot topic. So without further ado, here is just a brief overview of the items we're going to cover today. Our goal is to really put us all on the same page and understand where we currently stand with respect to vaccine distribution and administration, how that will affect businesses in your city, in your state, and quite frankly, across the country. various perspectives and concerns that are stemming from both workplace safety perspective as well as the human resource, employer's duty of care, which will also be a very important topic that I want you to keep in mind, and really where we stand today, what we can expect looking ahead, what are the expectations of what's going to happen as more and more people become vaccinated, and really what's going to be happening in the next week, month, and several months or years going down the road. So when we talk about vaccines in the workplace, I will come out and say, vaccine hesitancy is nothing new. Quite frankly, the flu vaccine for your seasonal flu came out about 1945. It was first made available to general public, and there was some hesitancy about what it's going to be all about, whether there were going to be any side effects, any implications or adverse health effects. So I will tell you this right now. This is not new, and we are looking at what CDC comes out, what FDA comes out and says, and their findings are very consistent. Vaccines currently administered in the United States are safe for consumption. Doesn't matter if it's the Moderna, Pfizer, or Johnson & Johnson. Even the latter has been put on pause for a little bit of time because of some adverse health effects that were discovered. When we look at the overall percentage of the distribution, it is truly, truly minuscule. We are not diminishing the unfortunate circumstances that occurred to those handful of individuals who did suffer those side effects. But overall, again, we have to consider how it affects on the population, on a wide number of people. And overall, again, we have to be mindful of the fact that vaccines are safe and general public is more than encouraged to get it. Also, for your state, vaccines are being made widely available to all qualifying adults, individuals above 16 years of age. However, let's be mindful of the fact that the distribution part of it, the supply chain, as it were, sometimes has little hiccups in it. So you may see certain areas and certain communities getting better supply and some getting worse. Some of you may be aware of multiple vaccination sites that are in your direct vicinity, and some of you may not even know where your nearest vaccination site is. And unfortunately, that's just how it's taking place right now. Hopefully, we will see improvements in that area, and we will see much better and even distribution of vaccines for all of the members of population. But we also need to be mindful of the fact that we as businesses, no matter what your industry is, you could be a white-collar company, you could be a warehouse, you could be a production facility, you will have your personal needs when it comes to vaccination, because obviously, if we do decide to bring more people back into the workplace, if they're vaccinated, that reduces the overall risk. And you really want to start thinking about how many people at least do I want to have vaccinated so that my overall risk for having more and more outbreaks at my facility, it diminishes with every passing day. Now, when we talk about the needs assessment and where do various industries fall, I'd like to direct your attention to this very handy pyramid that really outlines what you can do as an employer when it comes to requesting your employees to get vaccinated. Now, at the very top of the pyramid, we see a portion of the industry that is deemed business necessity. What that means, and let's consider a healthcare industry, a hospital, if you will. So that particular establishment would have patients who are suffering from COVID-19, and you would have employees who are delivering direct care to those patients. Obviously, we want those healthcare professionals to be vaccinated. In fact, the federal government and the state government can come out and say, we are giving this establishment a special number of vaccines just for their needs so that they can vaccinate all of their patient-facing individuals and even expand that to everybody else. So that's business necessity, where it is actually mandated by a higher authority, a state, federal government, so on and so forth. Then we have the employer mandated. This is where you, as a business owner, tell your employees, if we decide to bring people back, they must be vaccinated beforehand. Now, there is a bit of a pitfall in that statement, and let's look at it together. As I was just saying, there may be some implications dealing with supply chain management. Your area may not be well supplied, and people, even though they're willing to get vaccine, they want to get the vaccine, they might not even have the ability to get it. So if you mandate it for employees to come back, you may be tying your own hands, and you are not letting more people to come back simply because they're unable to get the vaccine, regardless of their personal desire. At the very bottom of the pyramid, we see categories such as hands-off and free market, where we just say, you know what, if you want to get the vaccine, go ahead and do it. If you don't want to get the vaccine, that's your personal decision. I actually like to see more and more businesses be in the employer recommended and employer incentivized portions. This is where you as a business owner tell your employees, I highly recommend you to get the vaccine because it diminishes the risk for yourself, for your loved ones, for your co-workers, and even for our clients. That really depends on what our business does. Does it work with members of general public? Does it commonly interact with other businesses, with other vendors, contractors, so on and so forth? So that's employer recommended. Employer incentivized is when you don't just recommend, but you try to make it even easier for your employees to get vaccinated. Maybe you assist with hosting a vaccination event so that people don't have to worry about traveling all over the place looking those vaccination sites. Again, it really depends on what your capabilities are, or you are advertising that you are going to let employees go at their during their work hours and get vaccinated. Again, you're making it more and more convenient for your staff to go out and get that vaccination and come back and make it much safer for everybody else, themselves included. Now, I want to pass the baton to my co-host real quick. And Sharice, if you don't mind, can you share with us some of the HR implications when it comes to vaccinated employees?
Right. Good morning, everyone. As my colleague Peter stated, although there is no overall federal mandate, there are some things still to consider to make sure that you don't have any liabilities within your workforce. As one, you want to remain an employer of choice, and employer of choice that focuses on workplace safety. So if you are incentivizing and recommending to your employees to get the vaccination, what does it look like if someone has a personal exemption? And to ensure that you're still remaining inclusivity for all employees. Having those conversations. So if someone has some religious beliefs that in which they do not, that does not allow them to get the vaccination, what does that look like? How do you accommodate them? There may be a medical history that prevents them from getting a vaccination. How do you have those conversations? I always recommend full transparency. Also welcoming the conversation with some type of support and documentation. But as you're collecting that documentation, just ensure that it's protected. Taking into account the American Disability Act and how you stay compliant with that, there may be a situation in which there is someone who has a disability that limits those engaging with the vaccination. How do you document that? As an HR professional, we recommend the interactive process to ensure that your business can accommodate to lower those risks, but also taking into account the business need. In the event that you do meet that top tier, the business necessity, how do you ensure that you maintain compliance with that? Compliance now goes with the documentation and ensure that there's confidentiality. And when there is, when you are incentivizing, what does it look like to have it all inclusive and welcoming for all? Peter?
Now, Sharice, before I go any further, I actually have a question for you exactly related to non-compliance. So you mentioned the business necessity tier. I'm going back to my earlier example of a healthcare facility, a hospital. Let's say you have, just for example, a nurse, somebody who is deemed a patient-facing individual. For some reason, they flat out refuse vaccination. What would be the recourse that their employer can take?
Well, one, you want to ensure that, as I spoke of, that there is no personal exemptions, there's no medical need, and there is no ADA or disability need, and have that accommodation. We do caution if all of that is removed and it is a personal request, looking at the essential duties of the business. Can that nurse go to a different type of unit? We do caution those employers who want to lead to immediate separation because it may be additional risk. So we always encourage having engaging conversations in which employees can voluntarily offer information to make the best business decision. But when it comes to non-compliance regarding personal decisions, you as an employer do have your rights to ensure that your business needs and your successes are met. And then it's just a different conversation that the employees and the employers come to the table and discuss. It's definitely not a one size fit all, because I always take into mind leaders to look at all risk and all liabilities. And sometimes what is presented to you may not be the full scope. So that's why that engaging conversation leads the precedence of your decision.
Wonderful. Thank you so much. That's honestly, as we talk with our clients, this is one of the questions that comes out most often. So let's talk a little bit more about workplace safety compliance. So let's say we are encouraging our employees to get vaccinated. More and more of them are coming back into a workplace and they are vaccinated. When we look at the employer's duty of care, does that mean we can suddenly throw our doors open and just invite everybody in? Unfortunately, the answer is no. All the precautions that we have been putting in place for the last, more than a year now, they still need to stay in place. So think about mask wearing. Think about social distancing. Facility disinfection, sanitizing, good hygiene practices, those still need to be put in place, those still need to be kept in place until further notice, at least while the nation is going more closer and closer towards herd immunity. Why is that so important? Now, OSHA, which stands for Occupational Safety and Health Administration on the federal level, and on the state side, you may have individual state OSHAs as well as more local regulatory guidelines. They have all these precautions in place because your duty is to still provide a safe work environment to your employees, regardless of the fact if they're becoming vaccinated or not. Mind you, we're still dealing with a population where a portion are already vaccinated, a portion is in process of getting vaccinated, and a portion is not vaccinated for whatever reason. Could be health related, could be personal related, but we still have those three portions within our population, and your responsibility is to provide even protection for all three. So our goal is to really make sure that you combine social distancing, creating barriers, staggering workplace scheduling, so you don't have too many people in the workplace. Quite honestly, if I had to boil down exactly what businesses should be doing right now with respect to safety, their goal should be, let's limit the overwhelming number of people in the same space, and let's limit any unnecessary person-to-person interaction. That is, anytime we spend more than 15 minutes at 6 feet or closer with another person. Now, obviously, for individuals who have been vaccinated, we can be a little bit more relaxed about it. However, while we're still dealing with a very mixed population when it comes to vaccine, we still need to be exercising as much caution as possible. Quite frankly, I've seen some of my clients still maintain what we call limited cohorts. Those are the situations where you have pods. small groups of individuals. They work together throughout the day, and they limit their interaction with other groups so that if, say, one of them is exposed to COVID and they actually develop the symptoms, they're not spreading it around to large groups of population. And if you have vaccinated individuals within that cohort, their risk diminishes even further. So again, our goal is to keep that risk level low, at least until we see more and more individuals becoming vaccinated. And again, I cannot stress this enough, we should not distinguish between employees who have been vaccinated and people who haven't been vaccinated. We cannot separate them into different groups. We have to treat them all as same workplace population. Now, Sharice, are there any EEOC perspectives to this matter that you would like to address?
Yes, and you spoke on it as far as separating your employees. EEOC, which falls under Title VII of the Civil Rights Law, federal law, also to maintain inclusivity. So whether it's you're in a protected class for gender, for religion, or even age, those rights still pertain. But Peter, you hit a very important point as far as treating everyone with equity and equality within a workplace. That's what increases the risk. So if someone does come and state that they do have a religious matter that interacts or contests the vaccination, how do you accommodate? But you do, as an employer, you do have a right to ask for documentation to support. How does that now cause interference within your job duties within itself? So having those specifics documented, because what you do for one employee, you definitely want to ensure that you're balancing with other employees for other different things. So some of the things that we've been seeing in the market and some of the questions that we have been receiving is, how do I manage someone who may have a religious belief that's against vaccinations, and then someone who has a medical or disability against vaccinations? Your approach will be the same. Although it's two different topics, they're still your employees and they still have the same rights protected under Title VII. So having that conversation, documenting a conversation, requesting documentation, whether it's to support a religious belief or whether it's to support a medical or disability, and ensuring that documentation is protected, in which you don't have any further violations within HIPAA or Privacy Act.
Terrific. Thank you so much, Sharice. Actually, there is another point that I would like to raise before we go further: hybrid workplace. So quite frankly, this is something we have seen really flourish in the last year or so, and it's something that we still encourage employers to maintain. Now, just as a quick catch up so that we all understand what this is about, a hybrid workplace environment is where you allow your employees to work at your site, whatever it is, whatever your industry may be, and at home. And whenever we consider workplace transitioning into a hybrid environment, there's just a couple of very important items that I would like for you to consider. You may tell yourself, look, we can't really have any employees work from home. Well, let's look at that question. Can't they be just as productive working from home as long as you accommodate them with respect to technology? Something I have seen happen with my clients, they move some of their HR capabilities to home. So suddenly, let's say you have a warehouse. Let's just use that for example. Obviously, some employees, because of their job description, because of what it is that they normally do, even in the pre-COVID times, they drive forklifts, they load and unload materials. They cannot work from home. That is understandable. They need to be on site. However, I'm thinking once again about human resources. I'm thinking about even accounting. As long as they have that technology connection, they have a decent laptop, you help them supply materials to set up their home offices so they're just as comfortable and productive as if they were back at the office. What's keeping you from letting those individuals working from home. Because think back to what I was saying earlier. Our goal is to limit the number of people who absolutely positively have to be in the workplace. So when you look at your job descriptions and you truly make that determination, can this person work remotely as long as they have the right technology? And if the answer is yes, I urge you to let those people make the decision of you can either work from home or you can work from the office. Should you choose to work from home, we will accommodate you. However, you don't want your employees to feel like they have to come back to work regardless of what their responsibilities are. Sharice, is there anything else you would like to add to a hybrid work environment setup?
I do. And when we speak on accommodations, each accommodation may look different. Working from home is a type of accommodation. So you may be able to accommodate someone to work from home full time versus the hybrid in which Peter was speaking of. So the accommodation within itself, it may be different. The process in which you lead to the accommodation and how you document that accommodation is what should be the same process. And as Peter stated, the goal is a healthy workplace. So explaining what those steps are, if someone is working from home and if they do have to transition, ensuring that there are safe practices and what that looks like for those who are not in the office. So working from home, hybrid is a type of accommodation, but how do you get from making that decision? And how you make that decision is where that conversation leads to ensure all of your risks and liabilities. So how you handle the manufacturing, you can accommodate. Maybe you give them some additional breaks in which they can now adjust their schedules while they're in a workplace versus that accounting, going back to Peter's example, they may be able to be at home. In that example, you have attempted to accommodate both employees in a safe way during this COVID time, but it's just two different accommodations, but they both received it.
Terrific. And as a matter of fact, that actually is a great transition into what we're going to talk next, liabilities. Because, so let's say in the ideal world, under ideal circumstances, 100% of your employees have been vaccinated. I want to personally congratulate you at this point. You got everybody vaccinated. Terrific. However, does the vaccine provide 100% protection from COVID? Unfortunately, no. There is a small chance that people who are fully vaccinated can still be exposed to COVID and they can still develop symptoms. The goal of the vaccine is really, first and foremost, to prevent severe illness, to prevent the person from going to the hospital and really turn it from a serious illness into a mild nuisance, if you will. And obviously to lower the risk of spreading it to others. Now, let's say you do have an employee who has been fully vaccinated in your fully vaccinated office or warehouse or factory, whatever your industry may be, they come up positive for COVID. And they inadvertently spread it to, let's say, your contractor or to your clients. Can you still be liable if you don't work with your local health department and report this outbreak? The answer is yes. Also, I have a number of clients from Texas that I work with. And as you may have heard on the news, the governor of Texas has come out and said, no more masks, just no more masks, regardless of whether or not you've been vaccinated or not, no more masks. Can you, as an employer, still have your own masking mandates? Yes, as a matter of fact, we encourage it. We encourage everyone to take a much more conservative stance. We know that masks can be uncomfortable, but it is truly the matter of protecting yourself and protecting your loved ones, in addition to protecting your co-workers, your clients, and those around you. And you, as an employer, are still liable in case you let your safety measures lapse and you have multiple individuals succumbing to COVID-19 because you did not follow the precautions, you permitted somebody bringing in the infection from the outside in and spread it around because you told your employees, come all back in, let's mingle, let's gather together in the huge town hall meeting as we always did beforehand. Unfortunately, we need to be very, very careful. As we move closer and closer to herd immunity, as I have been telling you, we need to be very careful with how much time we spend with each other, regardless of whether or not we are vaccinated. Now, Sharice, I've seen some clients start to demand vaccination as a pre-employment measure. What's your take on this?
I always caution that. It goes back to the chart in which you spoke on the business necessity. Because there is no overall federal mandate, and you're making that business decision, as long as there's a business case that does not exclude any one particular employee. Because going back to what Peter stated about liabilities, that is the goal, remaining healthy workspace, but also limiting liability. So when it comes to pre-employment vaccinations, it's a matter of the process. Determine if it's required, that is done during the hiring process, and that no one is not receiving their offer or not getting their job just because of the vaccination, based on there may be that personal exemption. You don't know that employee yet, right? So how do you have that conversations? But also taking into consideration what happens if I do elect to get the vaccination during the pre-employment process, and I may have an effect. What does that look like? How do you now accommodate even your prospect employees? How do you accommodate and keep your other employees safe? Peter spoke on incentivizing to ensure that there's no risk. You can offer different PTO policies or just have some type of leeway for your employees and those that are in the pipeline. So whether you offer sick time that's specific for vaccination, or you now accommodate them by saying, I know this position is scheduled to work in an office, but until you can arrive at work and ensure that you're safe, that maybe we can accommodate you and you work from home or do some type of hybrid fashion. So how you handle your pre-employment and how do you handle those who are currently employed should be aligned the same to keep those liabilities lowered.
Terrific. And really, this brings us to where we stand right now and what can we expect in the future. Now, right now, the numbers are decreasing across the country. It is finally what we wanted to see all this time. More and more people are becoming vaccinated. The numbers of infections and hospitalizations are decreasing. We're seeing more and more new guidances coming from Center for Disease Control, CDC. One of the most recent ones, hopefully you've seen it on the news, if you are fully vaccinated, you don't have to put your mask on when outside, as long as you're not inside a crowd. Similarly, when it comes to business travel, this is something that our clients have been asking us a lot. Individuals who are fully vaccinated, wherever they fly throughout the country, they are no longer in need of a quarantine after they either arrive or they fly out, which is great because now we're allowing more and more businesses to really resume a good portion of their activities. And this also comes into play when you look at your employees and you consider, who can I send to travel if this is part of what you do? So if it's somebody who's already vaccinated, you might want to give that person a priority because now it's much easier for them to move from one place to another. When we look at expectations of what can we see in coming months, as long as we're not seeing any new waves and we see a steady progression with new vaccinations taking place every single day, we should see more and more restrictions scaling down. Now, I am in California, and I'm going to use myself as an example. I don't know if you've heard on the news, what my state did was break out individual counties and give them a tier-based system. And the least restrictive tier Think about it. The least restrictive tier is what we call the yellow tier. We don't even have a green section. The least restrictive tier allows for 50% of employees coming back into the workplace. Let's say my state finally reaches that 50%. How will we progress further? I sure hope that one day we'll be allowed to bring in 75% or even 100%. We don't know yet. However, the outlook is positive. So I am asking you to, again, be patient. Remind your employees, implore your employees, recommend to your employees to get vaccinated. And as we go from day to day, we will see less restrictions being placed upon us. And quite frankly, this is our overall goal, to finally move out of this pandemic and get back to our normal everyday life. Now, really quickly, I want to share some resources that you can check out and supplement the information that Sharice and I spoke about today. So on the right column, you will see some of the Pennsylvania and Philadelphia resources with respect to coronavirus response, as well as we always like to include the Center for Disease Control and Prevention. They have a multiple question and answer sections that are dealing with various industries and how you can tailor your workplace to address most equitable and safe environment. Also, on the left-hand column, these are some of the resources that we publish for our clients as Insperity. So we have multiple webinars, such as this one, blogs, information regarding the Families First Act and CARES Act, crisis management resources, and really just a wide variety of information because our clients really do come from a vast variety of industries, and every single industry likes to do their things a little bit differently. And we respect that, and we try to tailor our resources to that, because quite frankly, what you give to a warehouse may not fit a law office, may not fit a doctor's office, and may not fit a factory. But our goal is to make sure that our clients have a personalized approach so that they feel like they can take care of their employees accordingly. And should you desire to become a client of Insperity, I would like to share some contact information for Manuel, who was our host, if you will, and has actually helped put this webinar together and bring Sharice and I to you. So here's his contact information. Now, I think at this time, Sharice, we're ready for some questions. Is that right?
Sure.
Okay. Sure. Manuel, are there any questions on the line?
I have two so far, but I ask all attendees, if you do have a question, definitely submit it via the chat. Via the Q&A function at the bottom of your screen, so we can get to it. So Sharice, I have two, and it looks like they're both for you. The first one, can we mandate vaccines as a pharmaceutical manufacturing facility in Pennsylvania legally?
So I am in Philadelphia. So while my colleague is in California, Pennsylvania has not mandated any particular industry. There are some positions in which you will have to look at those job duties and descriptions to see if they meet that. So, but across the board, there's no mandate, because again, similar to what Peter was saying, due to supply and demand, it's pretty difficult to put a blanket statement. So our governor has not done that as of yet.
Okay. Hopefully that addressed that. Lori, if there's a follow-up, definitely resubmit. Sharice, how would a company, or how should a company respond if they have an employee who indicates that he or she is unable to receive the vaccine because of a severely held religious belief or practice?
One, have a conversation with that employee to just better understand, and also to document the conversation. That employee, that is considered a personal exemption in which they are protected under Title VII. So you speak of an accommodation. Can that person now work from home? Can you now set something up in the office in which, they have the different obstructions? How is your office set up as far as wearing masks and different sanitizers? So you may have to emphasize what does safety look like in the workplace if there's no accommodation. That has been happening more often than not with those who have personal accommodations, personal exemptions that can be justified by documentation, and that is medical, disability, and religious beliefs. If I'll use myself as an example, if I do not want to get the vaccination just because I do not believe in it, that is not covered under Title VII. And then if it is impactful to your business, that now causes a different conversation between you and that employee. So I do lean heavy on having that conversation with the employee who says that they have a personal exemption, so that way they understand their responsibility to provide you documentation to support it.
Sharice, you dealt with the accommodations, or one specific accommodation, which was, the work from home option. But earlier on in the presentation, and I forget which one of you, whether it was you or Peter that alluded to it, but you mentioned ways to encourage employees to get vaccinated. What are some recommendations for that?
Incentivizing. Peter has stated some things as far as offering a vaccination sites or clinics. From an HR aspect, what does your benefits look like? Do you have the capability to offer some paid time off? Do you have a capability of having a flex schedule that says, sure, if you're going to go get vaccinated, you can log in a little later or log off early, just to make it, to remove that hardship of, there may be a wait for a line, there may be additional doctor's appointments, there may be follow-ups in the event that someone, if someone wants to get their family vaccinated, they may have to attend to their family. So what can you do as you have to know your demographics. If your demographics has, children at home, what does that look like? If your demographics has works in the evening, if you have a night shift, right? What does it look like if all the vaccinations are held during the day? Do you now give them a shift off or let them leave a little bit early? So looking at your business, understanding how you can accommodate. But one thing I always say is ask your employees. SurveyMonkey is free. You can use an account and 5 questions. What does it look like for you to return? Do you have any hardships of returning to work? Have you received the accommodation? Are you willing to receive the accommodation? And it's a voluntary participation. You get that data, and that data directly from your employees will help you lead to your business decision.
Sharice, I would actually like to jump in real quick.
Sure.
With respect to incentivizing employees, I actually have an example to share. So a client of mine who are a retirement residential community, they were lucky enough to get a CVS nurse to come out and administer vaccinations on site. Obviously, it was initially to accommodate their residents who obviously they're of failing health and may have a hard time traveling, but they've also opened it up to their employees. And it was almost like a health fair where you come in, you don't have to worry about traveling and looking for a vaccination site, get a donut while you wait, then get a shot. I think one important thing that's really, really important, you do not, should not, and cannot give monetary awards to people who are getting vaccinations. Because once again, we don't want to exclude individuals who are simply unable to get vaccinations because of their personal health issues. So I think that's important. However, I've heard examples of, hey, we give out a little bit of a company merch, or some like a keychain or a donut, or just something very truly minuscule, but hey, you came, you participated, you got your shot. Thank you very much for your participation.
So Peter, playing devil's advocate a little bit, when you said you can't give out a monetary reward for them getting the shot, how is that viewed in light of like giving them time off? So if I don't want to get the shot or I can't get the shot, I don't get that time off, but somebody who is getting the vaccination is given that paid time off. Is that the same thing?
No, that's not the same thing.
Right, I'll take that question because wages and benefits are viewed by the IRS very differently. So that's why I take it, it goes into two separate categories. And when it comes into giving a monetary benefit, you may start to venture into wages and Fair Labor Standards Act, which is a whole nother category. But then it's easier to exclude. I may say, oh, Peter has the same job as I. But if Peter gets an additional $100, and if we do the same job, you have now shown some type of treatment, which to Peter, and we're doing the same exact role. Now, if I'm in a protected class, that now may become an EEOC matter while you're just trying to do a nice thing. So if I'm in a protected class, it now moves from a vaccination matter to you have discriminated against me for any particular reason. Paid time off is very different because if you offer benefits, especially if you already have a vacation and sick plan, you as an employer can expand that differently.
That makes sense.
Mhm.
We have another question unrelated to that. Peter, you spoke earlier on, the CDC requirements or recommendations around travel, but you specifically addressed vaccinated people. The question is, what are the recommendations for travel for those who are not vaccinated? Do they need to quarantine upon return?
The answer is yes, it depends on where they're going. So let's say you decide to fly into California. I don't see why not. However, upon arrival into California, you fly into Los Angeles International Airport. Before you even exit the terminal, you're asked to register, supply your name, supply your address where you're staying. Why? Because you're told to quarantine for at least 10 days. Now, are you going to be checked on? Nobody knows. However, it's almost considered to be a guidance, a statewide guidance. If you're not vaccinated, you need to quarantine. This is why I stress that CDC has just come out and said people who are fully vaccinated, they are exempt from all of this. And if you are sending employees across the country, it's much easier for you to avoid any extra responsibility by simply sending over somebody who's already vaccinated. Mind you, if they come in contact with somebody who is COVID-19 positive, they are exposed, their risk is much lower. So you're already putting your employee at a far less risk. And something that you also should consider doing, just as Cherise mentioned, SurveyMonkey is free, indeed. And you can run a survey among your employees and say, look, how many of you are planning on getting vaccinated and how many of you are comfortable with traveling? So then you have a pretty good benchmark to determine, you know what, we should still keep our client service strictly remote, where we don't fly across the country. We only communicate with them by phone or by Zoom, just like we're talking to you right now. Or, you know what, a good portion of our people are in fact vaccinated. We can ask, okay, can somebody travel and address our client accordingly? Because it's been more than a year since we last saw them. We are trying to maintain our business value. We're trying to maintain our business relationships.
And just to piggyback on that, I always recommend a policy. If you have that already in your policy, it's already understood. So it's now April. If I want to plan for vacations in July and August, I already know and expect what to do when I return. So we encourage, as we're speaking of vaccinations, to have a voluntary vaccination policy. You have that as a follow-up to return to work. What does it look like? Include your travel requirements. Include if you are now going to have a voluntary vaccination policy. If you want documentation to verify the vaccinations are received, have that in there. But also have it how that information is going to be protected. But we always encourage everything regarding this topic, whether it's recommendations for travel or vaccinations, to have it already written out, have it distributed to your employees, give them an opportunity to ask questions because they know And what does that do? Lowers the risk, and that's being more strategic on the front end.
Good points. Is the company allowed to ask the individual employees if they've been vaccinated, or is that does it have to be voluntarily given?
If that small percentage falls into that business necessity, if that job requires it, or you deem that, it is required, because you have to know, going back to what Peter said, to ensure what is the exposure, right? So I have to know. But if you're still in a voluntary place and you're just trying to get an idea of where your employees are, we are recommending to have that information submitted in an anonymous way. I've been recommending surveys all year long, but I've been putting a little bit more emphasis ever since the vaccination topic has come up.
Now, Sharice, real quickly, going back to my earlier answer regarding travel, let's say I'm your employee and you pose the question, can somebody travel? That's part of your job descriptions, are you comfortable traveling? I approach you and I say, Sharice, I am fully vaccinated. I volunteer to travel. Is that disclosure permissible? Because I took it upon myself to volunteer that information to you.
Absolutely. Absolutely. And whether it's part of your job or not, if someone wants to come and just say, I'm vaccinated, I'm ready to return to work, or just in general conversation, that can kind of give you that idea. So what Peter was speaking on is having these conversations, incentivizing your employees. You may not have to ask the questions directly, because if the conversation just becomes, these are part of the steps that we're doing about returning to work and ensuring everyone's safe, it can just organically fit in conversations. And that's full disclosure, and there's no risk in that.
Thanks, Sharice and Peter. Thank you for the content and your answers to the questions. I think a lot of good information was shared, along with the resource page that's there. The deck will be made available to everybody that has registered and given an email address. I also want to thank EMSDC for partnering with us on this event. You know, this is something that it came about in a conversation probably in January with Val and I. How can we help the EMSDC's members and clients with some of the information that we have? We want everybody to, you know, succeed, be successful through the pandemic, and, you know, have a great business future ahead of them. How do we provide some of the resources that Insperity has to do that? So this is step one in that process. We are hoping to make this a series. So what you will see in the evaluation form that we're asking everybody to complete is the opportunity for you to help steer that a little bit, where you give us some suggestions. There's some examples given in there, but feel free to share some of the hot topics that are crossing your mind and your desk as business leaders. So you will get that. You'll get the information regarding the recording, and you know, we look forward to just hearing back from you. Let me know. My contact information is on the screen. Let me know if there's any way that we can get you more information. We can be supportive, or we can help you, you know, understand more about your HR opportunities with using Insperity services. So with that, I'd like to thank you all for attending and hope you enjoy the rest of your day.
Thank you, everyone. Stay safe.
Thank you all very much.